Good morning, myself Tanmay Gupta from Group 12. Today we'll be explaining a case of a 15-year-old male whose chief complaint is headache. So in this video, step by step, we will explain you through the causes and treatments of headache, starting with the physical examination and history taking of the patient. Beginning with the introduction, headache is quite common among the ages of 5 to 17. Almost around 20% of them do suffer, out of which the most common types are tension headaches and migraine. Its characteristic is its pain in head or face, and because of that, many of the times parents worries about any type of severe medical condition or brain tumor. But only less than 3% of them are reported to be of any severe cause. In general, lifestyle issues and stress are cause for these headaches in children and adolescents.
What's your age?
15.
So what brings you here?
I have a headache.
Can you tell me about the onset? Like one day or
Around 2 weeks.
around 2 weeks. How long does your headache last usually? Like 15 minutes?
Around 15 to 20 minutes.
So what's the type? Can you tell me, like, is it pulsatile or do you feel pressure like someone squeezing your head?
Feel pressure.
What's the frequency? Like it continuously increases or then decreases?
Increases.
Where do you have the headache?
The back of my head.
Can you tell me about the severity? Like, is it very mild or
It's mild.
did you notice any triggering factors? Like when do you have headache usually after doing some exercise or work? Did you notice?
It happens when I attend extra lectures after my school.
Okay, extra lectures after school. So, do you do anything to relieve it? Like lie down,
I take a short nap usually.
short nap, okay. So, do you take any kind of medicines, like pain relieving medicines for headache?
No.
Okay. Now, I'll ask about this past history. Do the headaches run in a family?
No.
Did you have any kind of head injuries?
No.
Did you go through any kind of emotional trauma, depression?
No.
Any kind of surgeries or infections? Now I'll ask you some confidential questions. So I need you to leave the room for 5 minutes.
Okay.
Thank you. Okay, I'll be asking you some confidential questions. Don't worry, I won't reveal this to anyone. Okay? So freely answer me whatever I ask you. Do you smoke?
No.
Do you drink?
No.
Do you do any kind of drugs like caffeine, marijuana, anything?
No.
Do you want to add anything else besides all these?
No.
Headache is the most common problem experienced by adolescents. About 20% of headache experienced by adolescents and adults are recurring, like tension headaches and migraines. The triggering factors of headache include certain foods, changes in sleep schedule, environmental factors, and stress. Pathophysiology of headache. The triggering factors of the headache include two pathways. This is due to the stimulation of hyperneuronal activity. The first pathway includes stimulation of autonomic center of brain. This has two effects. First is the stimulation of efferent neuron of fifth nuclei, which results in the release of serotonin, substance P, and neuropeptides. These substances are responsible for the release and activation of prostaglandins. The release of and activation of prostaglandins results in inflammation of extradural and extracranial arteries. This inflammation is the cause of headache. This stimulation of autonomic center of brain also results in the calcium influx in smooth muscles of arteries. This calcium influx results in vasospasm leading to cerebral hypoxia. Cerebral hypoxia is the cause of aura and vertigo. The second pathway includes the stimulation of adjoining vegetative center, which results in vertigo, imbalance, and nausea.
Treatment and tips to a 15-year-old with headache. Most occasionally, tension type headaches are easily treated with medications include aspirin, ibuprofen, acetaminophen, tricyclic antidepressants might help to manage chronic tension type headache. Alternative therapies are also used, which includes cognitive behavioral therapy, biofeedback, massage therapy, and acupuncture. Risk factors: you can get headache with or without risk factors, but more the risk factors, greater will be the chances of having headache. Risk factors include depression, anxiety, gum chewing, teeth grinding or clenching, arthritis in neck, sleep apnea, and being overweight. Stress, tiredness, and anger can cause tension headache. Other risks are smoking and not getting enough exercise or sleep.
Prevention of headaches during adolescence. We have written down a few suggestions. It is extremely important that we educate ourselves and our families regarding what headache is, and also keeping headache diaries and bringing that to your doctor's appointments will really help with the physical examinations, and keeping healthy diets and not skipping meals, especially breakfast, and also getting 8 hours of sleep with healthy exercise regimes 3 times a week for 30 to 60 minutes, and also avoiding certain headache triggers that could be food, beverages like caffeine, and also the lighting of a certain place, and avoiding of crowds or places that are noisy that could possibly lead to the trigger of your headache, and also reduction of emotional stress and also physical stress, taking time for yourself, de-stressing and offloading the day's worth of work that has accumulated in your body through relaxation skills such as meditation and yoga. Common mistakes while examining: we have performing inappropriate examinations, also not examining and listening to the patient properly, their chief complaints, the symptoms that they think they're experiencing, and also disregarding teenage headaches, not providing appropriate information, and not guiding the patient to appropriate cure.